start of the pandemic, our lives have all been so deeply affected. For our key workers, they have experienced more than their fair share of grief, strife and sacrifice. Our care staff have truly been the best of us during the last 16 months, nursing our loved ones at the end of their lives, being the person who holds our relatives when they are scared and confused, and facilitating greetings through windows, fences and across roads. They have been the family to our vulnerable relatives over the last year, and for that, I'll be forever grateful. And I don't think we'll ever be able to repay that debt. These aren't the words of a politician or even a doctor. They're the words of a daughter who's had to say goodbye to her father during the pandemic. And I'm eternally grateful for the care that my father received that went above and beyond what I could have expected. Carers who showed my family and I what humanity truly was, changing their shifts to be with him, being on the end of the phone whenever we needed them, and facilitating whatever they could in order for us to be with him in his last moments. And I can never repay my father's carers for the humanity that they showed him as his condition worsened, while my family couldn't be by his bedside. Carers were scared, and many still are. The idea of passing a deadly virus onto the people in their care tormented them. And that is why we're here today. The idea that care workers do not think about the day-to-day safety of the people they care about is an insult. From my own experience, I know that their residents are of utmost importance. So often poorly paid, they put in the gruelling work because they truly care. To argue that they don't neglects their fears. We want everyone working in a care home to take up the vaccine. The vaccine is safe and effective, but we aren't inclined to support these proposals or the case for compulsory vaccination. There are serious warnings from the care sector that the government's plan could lead to staff shortages in already understaffed care homes. This would have disastrous consequences on the quality of care. And it's vital that we examine the current reality of life on the front line in care settings. In fact, Unison surveyed their members during the pandemic who shared that they were feeling more anxious and depressed than before, owing to the fear of passing the virus on to their relatives and those under their care. Many felt that their management was not equipped to support their needs, and resoundingly the care workers just wanted people to listen to their experiences and the challenges they were experiencing without. And I quote, fear of being singled out as a troublemaker. Let's listen to our care workers today. Yes, I'll give way.
I'm really grateful to the speech that my honourable friend is making, and obviously pass on my condolences to her. But does she not agree with me, after all that our care workers have been through, that what they need at this time is a supported conversation about how they can progress with their own vaccination or not, but also just to have the right people in that place giving them that supported conversation?
My honourable member, it's almost my honourable friend, it's almost as though she has read the rest of my speech. I could not agree with her more. We have to listen to our care workers today. To the young pregnant carers worried about their next paycheck, will these proposals make them more secure? To all those carers from communities who have lost trust in authorities, will the threat of them losing their jobs instill more trust? And to all of those carers that have loved and cared for their residents but have concerns about the vaccine and haven't had anyone answer their questions, are they being told that their dedication is suddenly irrelevant? To understand why there may be hesitancy amongst care home workers to take up the vaccine, it is important to understand the health inequalities that much of the workforce face. Madam Deputy Speaker, ethnic minorities are overrepresented in the adult social care workforce, with 21% of all care staff coming from a minority ethnic background. Negative experiences of a culturally insensitive health service, the higher rates of death from COVID for people from Black and South Asian communities, and a lack of representation of minority groups in vaccine trials and wider health research all serve to build distrust in the health system. These are some of the communities that have been hit the hardest during the pandemic. The disproportionate use of coercive and restrictive practices on minority communities also erode important trust in the system. Black people are 4 times more likely to be detained under the Mental Health Act than white people, despite making up a much smaller percentage of the overall population. With trust so low, it creates hesitancy. But this hesitancy can be overcome through effective communication and an understanding of the issues which have created it. Further coercion and punishment through the threat of being dismissed from employment only reinforces the reasons for hesitancy in the first place. Yes.
I know what she's saying, and it was my first instinct months and months ago, exactly the point she's just made about persuasion. But more than 7 months on, it hasn't happened now. I'm tempted to ask, if not now, when, to coin a phrase. What is her response to that?
I thank the Honourable Member for his intervention. The response is that the government haven't gone far enough to have these conversations. That is why there has not been the real effort made to engage with the communities that have been hit the hardest and for whom vaccine hesitancy is at its highest. With trust so low, it creates this hesitancy that I've just spoken of, and this hesitancy can be overcome through effective communication that hasn't yet happened under this government's watch. It will disproportionately, I'm going to make progress, thank you. It will disproportionately punish groups whose needs are already rarely reflected in mainstream health services or the labour market. Respectfully listening to concerns and offering practical support would not only tackle vaccine hesitancy, it would also help rebuild trust in health services, which in turn could eventually lead to reduced health inequalities for all minority groups. Let's be clear. Vaccine hesitancy is entirely different to being an anti-vaxxer. Vaccine hesitancy is a challenge for the government to tackle. It's harder work. There is no quick fix. The government is trying to make an incredibly complex issue into a black and white one, and this does nothing to pay respect to the sacrifices that care workers have made since the start of the pandemic. And more must be done to encourage uptake of the vaccine. I'm going to make progress, please. The UK government should learn from the fantastic work of the Labour-led Welsh government, which is running the fastest vaccine programme in the world and vaccinated a far greater proportion of its staff compared to England. Yesterday's figures showed that almost 95% of care home residents and 88% of care home staff are double vaccinated. Wales has rejected compulsory vaccinations and instead chosen to work closely with the care sector to drive take-up, as well as valuing the workforce with a proper pay rise. It is that sort of leadership that is needed here. A failure of leadership here will place the care sector in an even more precarious situation than it currently is, with even fewer staff than at present. There are serious warnings from the care sector that the government's plan could lead to staff shortages in already understaffed care homes, and this would have disastrous consequences on the quality of care. Over 100,000 posts in the care sector are currently unfilled, with recruitment and retention already extremely difficult due to low wage levels for difficult and demanding jobs. Not only would this have a disastrous impact on those relying on care, but the stress and trauma placed on their relatives will affect so many across the country. We already have a social care crisis. Let's not deepen it. These proposals are at odds with the government's decision to throw caution to the wind by making social distancing and mask wearing optional and up for individuals to decide. It makes no sense. Surely forcing workers to receive a vaccine is at odds with the individualism they seek to promote at every opportunity. It seems odd then that care workers are being singled out. Why is there a different rule for them? If the government, hoping that the public will simply forget about their failure to protect care homes over the past year, is that what is going on here? To force carers to choose between losing their job or taking a vaccine that they're afraid of is inhumane. These are people who often work for less than the minimum wage. They are incredibly vulnerable people and their voices must be heard. Many of these people have lost multiple family members during this pandemic. They're being asked to put their faith in a vaccine they are afraid of. The government needs to be doing more to tackle misinformation, promote the positive benefits of taking up the vaccine and support care home staff to do so. They haven't been doing enough to support care workers who have done so much during this crisis. They should be focused on driving up standards and retention of staff by treating care workers as the professionals they are, with improved pay, terms, conditions and training. We have a moral imperative not to force people to take a vaccine they're afraid of. So I urge the government to listen to our care workforce. Surely they deserve at least that after the last year.